Now, Channel 3 News at 7.
Good evening, everybody. More parents are concerned as kids across the country catch Enterovirus D68. Doctors have spotted more than 275 cases coming up in late times right now of this respiratory disease or situation or virus that's going on. The virus was first identified 50 years ago, but it wasn't until recently that hundreds of cases were linked to the virus. And right now, the CDC is investigating whether 9 cases in Colorado are linked to the virus. Those kids have muscle weakness or paralysis. Joining me tonight is Dr. Michael Anderson, Chief Medical Officer from the University Hospitals, to talk about these rumors or to talk about the situation. Should we be concerned?
You know, I think parents are concerned whenever they see something making news like D68. The good news is we haven't seen marked epidemics of it. The cases have certainly increased, actually since July. We first started to see these cases in July. So I think parents are concerned. You also mentioned the cases that they're seeing in Colorado where kids are getting weak. So I think parents are on alert, but so far I think there's not a lot to be concerned about.
We can go way, way back in time. When you're talking about muscle weakness and things like that, the first thing that would come to mind of someone of my age would be polio.
Exactly. It's a very similar thing. You get a virus, and then after the virus, you have profound muscle weakness. The good news is, from the reports I'm seeing out of Denver, is that this weakness is not as severe as those patients that had polio, although we're not exactly clear as to what's caused it. So there is some room for concern.
3 things. Give me 3 things parents should look out for.
Number 1, most kids are just going to have a simple cold when they get this D68. Number 2, kids who have asthma, if they get cough or fever, those patients with asthma tend to have a worse sort of course with this disease. And 3, get a flu shot. This virus is not covered in the flu, but I tell each and every parent of a child over 6 months, get a flu shot.
So tell me this in general, and specifically, I guess, here in our area, are we seeing more illness at this time of the year than maybe you would in other years?
It's very strange to have a July, August, and September peak of viral illness of kids with respiratory disease. Pediatricians in Rainbow are used to seeing those in the fall, October becoming November.
Is that kind of a weather change?
It is. We see a couple different viruses, one called RSV, which affects younger babies, and flu, which affects older kids. But to have this peak in the summer, and now we're expecting a flu peak coming up, it's been a very busy time.
All right, so if you have any concerns out there and you're a parent, what would you advise?
First and foremost, talk to your pediatrician. Second, get a flu shot. And if your child has a cough, fever, is looking kind of ill, of course seek medical attention quickly.
All right, thanks a lot. Thank you very much. Good to see you.
Good to be here. Thanks so much, Jimmy.
Thank you very much. Now, as the election nears, Governor John Kasich has a 30% lead over Ed Fitzgerald. The lopsided